not just from a mental health perspective, but just as Dr. Kim and I'm sure Dr. Paul has said as well, if you have pre-existing gut issues or hormone challenges, or if you had, MSK issues in the past, it's likely any of these things could get flared up following a concussion. Those who recover from concussion and don't go on to develop persistent concussion symptoms are those who were less likely to have some of those predisposing factors. So I would start with reviewing that live we did. Nikki will hunt for us what the name of the live was and go from there. And just like a self-assessment, right? Checking in, hey, was this part of my life before concussion? As a way to sort of make sense of what's happened to you since concussion. Now, if you did have a predisposing factor around, anxiety or depression, for example, that doesn't mean you can't recover. It just
I was
means
just gonna say
that,
that. Yeah.
yeah, it doesn't mean you can't recover. It just means that you can identify that as a trigger and then start with the recovery mindset module to start developing skills to respond to how you're feeling now and what has manifested since your concussion. What it really does point to is perhaps before your concussion, you did not have the skills in place to recover from some of those stressors.